Welcome to the Bernade channel. Thank you for joining us. In today's comprehensive guide, we'll be exploring human papillomavirus, HPV, in depth, covering its types, transmission, symptoms, related health issues, prevention strategies, testing, treatment options, and when to seek medical help. What is HPV? Human papillomavirus, HPV, is a diverse group of more than 200 related viruses. It is one of the most common sexually transmitted infections worldwide, affecting both men and women. HPV viruses are categorized into two main types, one low-risk HPV types. These can cause warts but do not cause cancer. Two high-risk HPV types. These can lead to various types of cancer. Types of HPV. While there are many types of HPV, some are more significant in terms of health concerns. One type 6 and 11 cause about 90% of genital warts. 2. Types 16 and 18 cause about 70% of cervical cancers and precancerous cervical lesions. 3. Types 31, 33, 45, 52, and 58, also associated with cervical cancer. 4. Types 16, 18, 31, 33, 45, 52, and 58, can cause other HPV-related cancers such as anal, penile, vaginal, vulvar, and oropharyngeal cancers. How is HPV transmitted? HPV is primarily spread through intimate skin-to-skin contact. Transmission methods include 1. Vaginal, anal, and oral sex. 2. Close skin-to-skin contact during sexual activity. 3. Rarely, from mother to child during birth. 4. Possibly through non-sexual routes, such as shared towels or underwear, though this is less common. It's important to note that HPV can be transmitted even when an infected person shows no symptoms, and it may take weeks, months, or even years after exposure before symptoms appear. Symptoms of HPV. HPV infections often do not cause any noticeable symptoms, which is why regular screening is crucial. When symptoms do occur, they may include 1. Genital warts, small, flesh-colored or gray swellings in the genital area. They can be flat or raised, single or multiple, small or large. 2. Oral or upper respiratory lesions, warts or lesions in the mouth or throat. 3. Cervical changes, detected through pap smears. These are often asymptomatic. 4. General symptoms. In cases where HPV leads to cancer, symptoms may include unexplained weight loss, fatigue, bleeding, or pain. HPV-related health issues. HPV can lead to several health problems. 1. Genital warts, non-cancerous growths that can appear on the genitals, anus, or surrounding areas. 2. Cervical cancer, the most common HPV-related cancer, caused by persistent infection with high-risk HPV types. 3. Other cancers, including cancers of the vulva, vagina, penis, anus, and oropharynx, back of the throat, including the base of the tongue and tonsils. 4. Recurrent respiratory papillomatosis, a rare condition where warts grow in the throat. 5. Precancerous lesions, such as cervical intraepithelial neoplasia, CIN, which can progress. HPV-related health issues. To cancer if untreated. Prevention of HPV. Several strategies can help prevent HPV infection and related health issues. 1. Vaccination. The HPV vaccine is highly effective at preventing infections with the most dangerous types of the virus. It's recommended for all children aged 11 to 12 years, can start at age 9, everyone through age 26, if not vaccinated already, some adults aged 27 to 45 who are not already vaccinated, discuss with your doctor. 2. Regular screening, for women, regular pap smears and HPV tests can detect precancerous changes in the cervix. 3. Safe sexual practices, using condoms and dental dams. Prevention of HPV. Consistently and correctly, limiting the number of sexual partners, being in a mutually monogamous relationship. 4. Communication, discussing sexual health and HPV status with partners. 5. Abstinence, the only 100% effective method to prevent sexually transmitted HPV. Testing for HPV. Several tests are available for HPV-related conditions. 1. Pap smear, detects abnormal cells in the cervix. 2. HPV test, detects the presence of high-risk HPV types in cervical cells. 3. Visual inspection, for visible genital warts. 4. Biopsy, if abnormal cells are detected, a biopsy may be performed to check for cancer. 5. Anoscopy, examination of the anus to detect anal cancer or precancerous changes. Treatment options. While there's no cure for HPV itself, treatments are available for HPV-related conditions. 1. Genital warts, can be treated with topical medications, cryotherapy, freezing, or surgical removal. 2. Precancerous lesions, can be treated with procedures like loop electrosurgical excision procedure, or cryotherapy. 3. HPV-related cancers, treated based on the type and stage of cancer, often involving surgery, radiation, and/or chemotherapy. 4. Watchful waiting, in some cases, especially in young people, HPV infections may clear on their own without treatment. When to see a doctor. Consult a healthcare provider if 1. You notice any unusual growths, bumps, or symptoms in your genital area. 2. You're due for routine cervical cancer screening, pap smear and/or HPV test. 3. You want to discuss HPV vaccination. 4. You've been diagnosed with HPV and have questions about management or prevention. 5. You're experiencing anxiety or concerns about HPV or sexual health. Living with HPV. If you've been diagnosed with HPV, 1. Follow your doctor's recommendations for follow-up and treatment. 2. Inform current and recent sexual partners about your HPV status. 3. Continue to practice safe sex to prevent transmission. 4. Don't smoke, as smoking can increase the risk of HPV-related cancers. 5. Maintain a healthy lifestyle to support your immune system. 6. Remember that most HPV infections clear on their own within 2 years. Important notice. This presentation is for informational purposes only and should not be considered medical advice. Always consult a qualified healthcare professional for diagnosis, treatment, and answers to your personal medical questions. For more health information, download the Burnaid app for free from the Play Store or App Store. Get answers to over 3,000 medical questions at your fingertips.